Welcome, everyone, to our live trivia show. Get ready to put your knowledge to the test. Today's topic is ophthalmology, the fascinating world of eye health and vision science. Whether you're an eye care professional or just curious about how we see the world, this quiz is for you. We'll explore everything from cataract surgery and glaucoma to retinal disorders, corneal conditions, infections, and even neuro-ophthalmologic mysteries. It's time to blink, focus, and dive into the details of the human eye. Here's how it works. You'll face 25 multiple-choice questions. Each question has 4 answer options, only one is correct. The faster you respond, the more points you earn. To answer, simply comment the number of the correct option or type the full answer. So sharpen your vision and your reflexes. Remember, 25 questions, 4 choices, speed counts, and answer by number or full text. Let's get started. Here comes question number 1. In cataract surgery, you notice zonular dialysis involving 5 clock hours. The best next step is 1. Place a 3-piece IOL in the sulcus without CTR. 2. Insert a CTR and continue phacoemulsification carefully. 3. Convert to extracapsular extraction. 4. Abort surgery and refer to a vitreoretinal surgeon. Take a moment to think it through. This one's all about surgical decision-making under pressure. Zonular dialysis can be tricky, but with the right approach, the outcome can still be excellent. Remember, speed matters. Comment the number or type the full answer. Let's see who's got steady hands and sharp minds. Zonular dialysis often occurs in trauma or pseudoexfoliation syndrome cases. 15 answered correctly. Great job, everyone. Well done, Ahmed Adel. Nice work, Mohammed Habib. Question 2 coming right up. During preoperative evaluation for cataract surgery, a 38-year-old patient is noted to have this cataract. What surgical precaution should be taken in this case? 1. Use of iris hooks to stabilize zonules. 2. Prefer extracapsular cataract extraction over phacoemulsification. 3. Create a large capsulorhexis to facilitate cortical removal. 4. Avoid hydrodissection due to posterior capsule fragility. Think carefully, young patients can present unique surgical challenges. Some cataracts may look routine, but behave very differently. Lock in your answers. Precision matters in every step. Let's see who's thinking like a surgeon today. Posterior subcapsular cataracts often affect younger patients and progress rapidly. 11 answered this correctly. Great job, everyone participating. Well done, Osama Abakala. Nice work, Mohammed Al-Gohari. Excellent, Mustafa Kamal too. Bravo, Mohammed Habib indeed. Here comes question number 3. A slit lamp exam reveals ring-shaped, anterior capsular opacities that resemble a sunflower. What is the most likely underlying etiology? 1. Iron deposition in the lens. 2. Diabetes mellitus. 3. Copper deposition in the lens. 4. Chronic uveitis with steroid use. Sunflower cataracts sounds pretty, but definitely not harmless. Clues in the shape can reveal systemic disease links. Eyes can reflect deeper metabolic or toxic conditions. Submit your answers. Let's see who's shining bright. Sunflower cataracts are often linked to Wilson's disease, involving copper accumulation. 5 got it right. Tough one, great try. Well done, Osama Abakala. Nice job, Ezra Tura. Kudos, Mahmoud Hamada too. Bravo, Mohammed Habib again. Here comes question number 4. Which of the following glaucoma might not resolve after cataract extraction? 1. Primary angle closure glaucoma. 2. Phacolytic glaucoma. 3. Microspherophakia with glaucoma. 4. An eye with angle recession and phacodonesis after blunt trauma. Not all glaucomas behave the same post-surgery. Some improve dramatically, others remain stubbornly elevated. Think about the underlying mechanism, lens-related or structural. Lock in your answers now, future ophthalmology legends. Angle recession glaucoma often results from blunt trauma to the eye. 13 answered it correctly. Great job, sharp minds. Well done, Ahmed Fouad. Nice work, Saif Whaley. Bravo to Dodi Dodi. Cheers, Mohammed Amin too. Here comes question number 5. A close-up photo of the iris shows multiple small, white-grayish spots arranged in a ring near the periphery of the iris. What is the most likely diagnosis? 1. Lish nodules and neurofibromatosis. 2. Iris mammillations and ocular melanocytosis. 3. Brushfield spots and Down syndrome. 4. Axenfeld-Rieger anomaly. Tiny iris clues reveal big diagnostic secrets. Pattern recognition is key in ocular findings. Think syndromes, pigmentation, and systemic associations. Submit your answers now, eye detectives. Brushfield spots are more visible in individuals with lighter colored irises. 12 got it right. Nice work, sharp minds. Well done, Saif Whaley. Great job, Amal Saleh. Kudos, Mahmoud Hamada 2. Bravo to Dodi Dodi. Time for question number 6. Which one of the following is an example of a valved aqueous shunt glaucoma drainage implant? 1. Shochet implant. 2. Maltino implant. 3. Bearvelt implant. 4. Ahmed implant. Valves help regulate intraocular pressure safely. Each device has unique flow control features. Think about fluid dynamics and glaucoma management. Lock in your answers now. Ahmed implant includes a valve to control aqueous humor flow safely. 17 answered it correctly. Smart move, sharp minds. Nice job, Abir Elowa. Well done, Osama Abakala. Great work, Saif Whaley. Bravo to Ezra Tura. Here comes question number 7. What is the most common reason for long-term visual loss in primary infantile glaucoma? 1. Glaucomatous optic nerve damage. 2. Corneal scarring. 3. Corneal edema. 4. Amblyopia. Vision loss can have multiple causes. Infant eyes are still developing rapidly. Each option affects vision differently over time. Submit your answers now, everyone. Amblyopia is often called lazy eye and affects early childhood vision. 12 got it right. Brain's working full speed. Nice job, Noran Shaki. Great work. Well done, Kira Karyai. Bravo to Muhammad Fadloon. Time for question number 8. What is the diagnosis here? 1. Vitreous hemorrhage. 2. Retinal detachment. 3. Posterior scleritis. 4. Choroidal detachment. Each option affects the eye differently. Think carefully, diagnosis guides treatment choices. Ophthalmology can be quite the mystery. Lock in your answers now. Choroidal detachment can occur after eye surgery or trauma. Watch for vision changes. 24 answered correctly. Impressive diagnostic skills, everyone. Nice job, Muhammad Fadloon. Well done, Muhammad Al-Gohari. Great work, Osama Abakala. Bravo, Saif G. Whaley. Here comes question number 9. Which disorder isn't chlamydia related? 1. Neonatal conjunctivitis. 2. Molluscum contagiosum. 3. Lymphogranuloma venereum. 4. Endemic trachoma. Chlamydia can affect multiple systems. Some options might surprise you. Choose wisely, your streak continues now. Molluscum contagiosum is caused by a poxvirus, not chlamydia, important distinction. 18 players answered correctly. Nice work, Muhammad Al-Gohari. Well done, Osama Abakala. Great job, Saif G. Whaley. Bravo to Mustafa Kamal. Here's question 10, let's go. What causes Parno-oculoglandular syndrome? 1. Tularemia. 2. Tuberculosis. 3. Sporotrichosis. 4. Bartonella and Seeley. Think fast, choose wisely. Cats might offer a clue. Parno syndrome often links to cat scratches. Watch those playful paws closely. "22 players got it. Nice job, Saif G. Whaley. Well done, Muhammad Fadloon. Great work, Muhammad Al-Gohari. Kudos, Muhammad Amin 2. Here comes question 11, focus up. Which corneal degeneration causes painless inferior ectasia? 1. Terriens marginal degeneration. 2. Pellucid marginal degeneration. 3. Keratoglobus. 4. Keratoconus. Answers coming in fast. Inferior thinning sounds oddly specific, doesn't it? Pellucid marginal degeneration often shows a classic kissing doves topography pattern. "21 players answered correctly. Nice job, Muhammad Al-Gohari. Well done, Mahmoud Hamada. Great work, Mohammed Fadloon. Kudos to Mohammed Amin. Here comes question 12, stay sharp. OCT skin post-glaucoma surgery, what's the diagnosis? 1. Hypotony maculopathy. 2. Epiretinal membrane. 3. Cystoid macular edema. 4. Central serous chorioretinopathy. Eyes on the prize. Think OCT changes, subtle clues can reveal everything. Hypotony maculopathy often shows chorioretinal folds on OCT after surgery. "24 players guessed right. Nice work, Safe G. Whaley. Great job, Dodi Dodi. Well done, Mohammed Fadloon. Bravo, Mohammed Ali Shaban. Question 13 coming your way. Which factor increases risk for this condition? 1. Stress or corticosteroid use. 2. Low blood pressure. 3. High blood sugar levels. 4. Excessive caffeine intake. Choose wisely, think clinically. Some triggers are sneakier than they appear. Corticosteroids can disrupt fluid balance, increasing risk of certain eye conditions. "32 players answered correctly. Nice job, Mohammed Fadloon. Well done, Osama Abakala. Great work, Kira Carriai. Bravo, Safe G. Whaley. Question 14, let's dive in. What organisms cause ARN in porn? 1. Varicella zoster and herpes simplex. 2. Rubella and rubeola. 3. Mycobacterium tuberculosis and Treponema pallidum. 4. Borrelia burgdorferi and Bartonella henseli. Make your selections now. Viruses love targeting the retina, sneaky little invaders. Retinal necrosis progresses rapidly. Early diagnosis is crucial to prevent blindness. "34 players answered correctly. Nice work, Ashdod 51. Great job, Noran Shaki. Well done, Kira Carriai. Bravo, Safe G. Whaley. Question 15, eyes on screen. This lesion links to vitamin deficiency, guess which? 1. Vitamin E. 2. Vitamin D. 3. Vitamin C. 4. Vitamin A. Lock in your answers now. Vitamins play vital roles, some more eye-catching than others. Vitamin A deficiency can cause night blindness and dry eyes. Watch your diet. "36 players chose correctly. Nice job, Mustafa Kamal. Well done, Mohammed Al-Gohari. Great work, Safe G. Whaley. Bravo to Dodi Dodi. Question 16, focus your eyes. Which treatment doesn't belong here? 1. Vitrectomy with internal limiting membrane peeling. 2. Topical steroid. 3. Topical NSAIDs. 4. Subtenon's Kinacort. Choose wisely, some options soothe, others overdo it. The retina processes light signals before sending them to the brain. Amazing, right? Only 5 answered correctly. Nice work, Mohammed Amin. Well done, Dr. Mariam. Great job, Dodi Dodi. Bravo to Imam Mohammed. Question 17 coming in now. How do we measure AC/A? 1. Major amblyoscope. 2. Krimsky. 3. Hirschberg. 4. Gradient. Choose carefully, precision matters in strabismus evaluations. Esotropia often involves overactive convergence, linked to the accommodative system in children. Gradient was correct, everyone. 28 nailed it, impressive. Nice work, Safe G. Bravo, Mohammed Fadloon, 2. Shout out, Mustafa Kamal. Well done, Mohammed Ayman. Question 18, let's test your optic nerve knowledge. Which finding suggests optic disc drusen? 1. Inferonasal visual field defect. 2. Dyschromatopsia. 3. Choroidal folds. 4. Central scotoma. Eyes sharp? Let's see those answers roll in. Optic disc drusen are calcified deposits in the optic nerve head. Correct answer, visual defect. 13 got it right. Nice job, Safe G. Well done, Dr. Merriam. Great work, Mohammed Al-Gohari. Cheers to Dodi Dodi. Question 19, let's diagnose this corneal conundrum together. Image shows bilateral interstitial keratitis, no ulceration. What's the most likely diagnosis? 1. Syphilitic interstitial keratitis. 2. Morin's ulcer. 3. Herpes simplex stromal keratitis. 4. Cogan syndrome. Eyes on the clues, submit your best guess now. Cogan syndrome can affect hearing, causing sudden sensory neural hearing loss. Correct answer, Cogan syndrome. 11 players guessed right. Nice work, Kira Karii. Bravo, Ikrami Zikri Abashi. Well done, Radwa Adel. Cheers to Mohammed Fadloon. Question 20, let's dive into systemic clues together. 19-year-old female, corneal whorls, burning hands. Also decreased sweating, what's the likely systemic condition? 1. Wilson disease. 2. Refsum disease. 3. Marfan syndrome. 4. Fabry disease. Think fast, your diagnosis skills are shining now. Fabry disease often causes whorl-like corneal deposits called cornea verticillata. Correct answer, Fabry disease. 32 players answered correctly. Great job, Mohammed Fadloon. Well played, Safe G. Whaley. Nice work, Mahmoud Hamada. Cheers to Mohammed Al-Gohari. Question 21, let's test your clinical instincts now. 45-year-old woman, painful scleral nodule present. It doesn't move or blanch, what's your next move? 1. Start artificial tears. 2. Reassure and observe. 3. Prescribe topical antibiotics. 4. Order ANA, RF, ESR, CRP. Think carefully, systemic clues may guide your next step. Scleritis often signals systemic autoimmune disease. Labs help confirm underlying conditions quickly. Correct answer just in. Order ANA, RF, ESR, CRP. 31 players got it. Nice work. Well done, Osama Abakala. Great job, Mohammed Al-Gohari. Kudos to Mustafa Kamal. Question 22, Neuro-ophthalmology fans, this one's yours. Where's the main problem in Duane syndrome? 1. Third nerve nucleus. 2. Sixth nerve nucleus. 3. Medial longitudinal fasciculus. 4. Cavernous sinus. Think anatomy, nerve pathways matter more than you think. Duane syndrome often involves limited eye abduction due to nerve miswiring. Correct answer just in. Sixth nerve nucleus, confirmed. 29 players answered correctly. Nice work, Mohammed Fadloon. Well done, Safe G. Whaley. Great job, Radwa Adel. Kudos to Dodi Dodi. Question 23. Keep those brain cells buzzing. Superior limbic keratoconjunctivitis is linked with what? 1. Thyroid eye disease. 2. Systemic lupus erythematosus. 3. Sarcoidosis. 4. Rheumatoid arthritis. Think systemic clues. Eyes often reflect deeper health issues. Superior limbic keratoconjunctivitis often presents with redness, irritation, and upper tarsal inflammation. Correct answer is in thyroid eye disease, confirmed. 31 players got it. Nice job. Well played, Mohammed Al-Gohari. Great work, Mohammed Fadloon. Impressive, Saif G. Whaley. Question 24, eyes on the screen. What type is this nystagmus you're seeing? 1. Upbeat. 2. Vestibular nystagmus. 3. Seesaw. 4. Pendular. Focus on the motion, rhythm reveals the mystery. Seesaw nystagmus often indicates paracellular or midbrain lesions affecting vision. Correct answer, seesaw. 7 got it right. Well done, Saif G. Whaley. Nice job, Ezra Tura. Great work, Inez Ali. Bravo, Muhammad Ali Shaban. Final question, let's finish strong. Which condition does this video suggest? 1. Superior oblique palsy. 2. Duane retraction syndrome. 3. CN6 palsy. 4. Brown syndrome. Watch closely, eye movement tells the story. Brown syndrome limits eye elevation during adduction, often congenital, sometimes acquired. Correct answer, Brown syndrome. 18 answered it correctly. Well done, Saif G. Whaley. Nice work, Radwa Adele. Great job, Kira Carey. Bravo, Dr. Shima El Arabi. Ezra, Mahmoud, Mustafa, champions with 21. Mohammed Ayman close behind, 20 correct. Huge congrats, everyone. Thanks, all 46 players.